welcome Ian Norton, who's tuning in from Australia. And Ian, I'm just going to frame very quickly what I want to look at today. And then I'd like to bring you in quite early because it's so late in your evening. I'd also like to welcome James Ritchie. James and I had quite an interesting exchange after the last OOB. James watched the recording because he wasn't able to join live, but I'm very keen for James to get the floor quite early because remember that James works for the International Union of Food and Allied Workers and has been really taking the lead on the COVID challenges faced by migrant workers and people working in the meat, fish, sandwich and other similar industries, which are still being really badly dented by COVID. And I want to give space to James. There are many of you who are working on leadership issues around COVID, and I'm keen to bring you in as well. So here's my just very quick framing remarks for you. We have a really very rapid acceleration of the spread of this virus all over the world at the moment. It's picked up, and if you look at the global figures, we see a real acceleration in reported numbers, and we know that these are just a subset of the total numbers. And there really are two options now facing governments and other officials. One is to get really upset and concerned and express anxiety and fear. And on the basis of that, to impose more and more restrictions on how people go about their lives. And in some cases, to go back into complete cessation of movement and lockdown. And I use that word deliberately, lockdown. And that is what is being dangled before many European populations at this time. Hundreds of millions of people. The alternative is to continue to really reflect on the power of collective working, breaking down the barriers between different groups of people, working together to find ways to both change people's behavior and also introduce more effective means for interrupting transmission and stopping the spread of the virus. What I'm calling the excitement of collective working. And the reason why I say that is that we now have examples from all over the world where really improving how different groups work together at interfaces and creating more integrated work styles, whether it's in the factories that James and the union members are working in, or whether it's in the states of Australia where Ian is working, or whether it's in different parts of the UK where Holly is working and John is active, whether it is also in the very difficult situation in Kathmandu and the rest of Nepal where Rojan is active. I want you to just help me to collect together either examples of where solemn, anxious, and really quite nervous reactions by government is having a result. And I think it is in some places, so I want to hear about that. And also places where there is the excitement of collective integrated working that is really making a difference. And I want to explore this like we've done before, building into this, of course, the communications, the messaging, because if your messaging is solemn, then it will be about overflowing hospitals and overloaded health services and people dying. If your message is one of excitement, it is, hey, what the potential we have if we work together and engage different actors in the community. let's just play and explore. Of course, it's deadly serious, but it's something that each one of us has got a view on. So order initially for starting. Our colleague Ian, tell us where you are and what you're doing, and then James, but I want to broaden it up, and if you just flag or make a sign that you want to come in, please do so. And all members of the 4SD team, we've just had a meeting about this, please feel free to come in anytime, don't hold on ceremony. And I think Selby Zuma, I want to just say hello to you. Oh, that's the name on your thing. I haven't noticed you before. Welcome to you if you're new, and others who are new participants. This is it's a moderated discussion, and if you want to speak, you are very welcome to do so, and we can help you. We do short interventions. Ian Norton, please.
Thanks, David. Great to be with everyone. I'm in Queensland in the northern part of Australia. So not too early. We haven't changed our clocks here, about 4:30 in the afternoon. But a couple of things, if I could. Maybe I'll start with the situation here in Australia and that great question you posed, David, on an example of conservative approach and perhaps a different, more upbeat approach and trying to bring along the population. We have two states who are side by side, Victoria and New South Wales, which are what's really interesting. New South Wales has recurrent caseloads around 10 per day, so vastly smaller than anywhere in Europe or other places, and yet that is very big news here in Australia because, of course, we've done well till now. But New South Wales' approach in a very much a decentralised, local area-led public health system, very much in control of their situation, clear messaging from the Premier at the state level. And they, in fact, are announcing almost daily, and they're going to make some new announcements this weekend about opening up to larger and larger family and social gatherings and more and more interaction in the spring and into summer. So things are really looking healthy and strong in New South Wales. The economy is in a good shape. And it's fascinating then to look across to Victoria, who's just gone through over 100 days of some of the most austere lockdown conditions in a city anywhere in the world. Their case number today was 1, and they are still in almost full lockdown condition with a mandatory isolation at home apart from essential movement for certain agreed things, and then they've just gone from 1 to 2 hours of exercise allowed per day as an individual. So it is fascinating to see the absolutely different approaches, not just on number, but approaches by the government. And of course, then the population feeling, you can just imagine the difference between those two large populations in our two most populous states. I think another thing that's just come out, which is really disappointing in a way, the seafarer approach. So this is something I suppose for James as well to look at, not his area, but there's certainly an issue with workers and particularly low-paid workers who work on these merchant vessels around the world. We just had a series of infections on board being introduced in West Australia's had 2, Port Hedland up in the north where all the mining and ore is shipped in and out, and then in Fremantle in Perth to the south. And now just in the last day or so, just offshore from me, maybe 10 kilometers from here, there is a bulk carrier there as well that had been from Manila, went down to New Zealand, caused, we think, 1 or 2 cases in Auckland Port, and then it's now here, and we've just offloaded 2 unwell people from that vessel who are positive into our local hospital just down the road from me here. So that has caused an instant reaction. It's very interesting to see almost an insular approach across the country. And we said this several times, but those of you who I haven't talked to before, we have a central, federal government who has tried to set quite a balanced public health agenda and some clear guidance. And each state and territory has interpreted in different ways that guidance, and to, I think, a detriment in some populations and the positive to another in those 2 examples. If I can then, David, switch a bit to the Pacific and our near neighbors who are, ranging from the very large countries like Papua New Guinea and 8 million people, and then to the very smallest states in the world, and generally done really well and isolated, I'm afraid, economies in real trouble because, of course, their reliance on tourism and other visitors and things. But an interesting mix. We have French Polynesia and Guam, particularly with high levels, relatively high levels, thousands of cases. Guam announced their 67th or 68th death today, which is large in a small population. And yet then you have other countries that have had no cases whatsoever, Vanuatu, Tonga, etc. Fiji has done a good job of managing their situation. But I just wanted to highlight Solomon Islands, and you and I have discussed a bit of this, David, in the last few days. Now, the Solomons, just off the coast of Papua New Guinea, they had watched Papua New Guinea's outbreak for some time now and had put some medical teams to the north, to the small islands, the short islands, just shortland islands to the north, to try and make sure that there wasn't any ingress of disease there. But they've introduced 3 positive cases from a group of students who returned from the Philippines. Now, they're still in quarantine. Luckily, so far, we've had no outbreak from that quarantine situation. But what's really worrying is the Prime Minister has very actively messaged the population. He uses Facebook mostly to communicate, and he's been saying that if there's any breakout and into the community, then there will be instantly quite a severe lockdown, particularly in Honiara and across the main islands, Guadalcanal, etc. That is a worry if anybody knows Papua New Guinea, Solomon Islands, and it's similar in Papua New Guinea. People generally are extremely poor, have poor access to food storage, and therefore generally shop each day, as many do in the Pacific. The rates of domestic violence in the Solomons are amongst the worst in the world, and we really do fear, if there is a severe lockdown, how that will affect those vulnerable populations. And we don't see a sort of World Food Programme approach to supply food if there's going to be a lockdown, which we saw, I think, relatively effectively done in Sierra Leone back in the day, in West African Ebola, but that sort of logistic support to populations is a real worry. I'll pause there, David.
Ian, thank you for the quick report on the Pacific. It does seem unfortunate that there is a threatening of a severe lockdown if there's even one case picked up in mainland Solomon Islands. We're all the time saying that it really is desirable to avoid going into these strong lockdowns as an immediate reaction for the reasons you just said. Thank you for making that observation. Thanks also for comparing Guam and French Polynesia with Vanuatu and Fiji. This is also, I think, very important. What happens on islands is different from what happens on mainland areas, but the comparison between Victoria and New South Wales is super interesting. And but the city in Victoria, everybody is Melbourne, and that's there's been quite a lot in the papers about the Melbourne story. And it's a very good of you, Ian, to bring that out. I'm sorry about this problem in these boats. Somebody told me there's a very large number of thousands of seamen who actually have been unable to get on land and get home to their families at the end of their contracts. All over the world, there's a sort of stranded population of seafarers. And it's something that the world is sort of slightly forgotten about. Am I right, Ian? I mean, you pay quite a lot of attention to the whole shipping industry.
Yes, we do. I mean, it's the merchant vessels for one, and it's also the cruise groups as well. A lot of them sitting in Manila Bay and other parts of the world trying to restart with it. We can talk about the cruise industry at other times, I suppose, but it has been fascinating. Unfortunately, many governments have taken quite a no-risk approach to this, and they've sort of done it for their own population protection, but they've forgotten there are people involved, and that's the really disappointing thing.
Thank you. Ian, thanks a lot. Thanks a lot. People who work in transport do have a bad time. I just read a report that there's been yet more deaths of bus drivers on the London bus system. 50+ bus drivers have died. And it just shows how important looking after the well-being of those who transport us and look after us really is. Some of them are having to live and work under quite awful conditions, and that's why they're at risk. Could I go to James Ritchie? James, I'm as broad or as narrow as you like, really thinking through from your vantage point as dealing with this union that looks after so many workers who are underpaid. How do things look for you at the moment?
Well, thank you, David. Good morning and good afternoon, Ian. It's very nice to see you, and hello to everyone else on the briefing today. It's a very mixed picture, I think, David. I think that where there is success is where there is commitment is built by the employer, by the union in the workplace to negotiate protocols which are as safe as possible. And there is nothing new about the approach to safety in the workplace that is brought about by COVID-19, because the standards are there in the ILO Convention 155 about how to approach safety in the workplace. You identify a hazard, you try and remove the hazard. If you can't remove the hazard, then you try and manage it through administrative controls or engineering controls, and then you add to that by minimising exposure, and that's the personal protective equipment, which is so important. And it's become very apparent that in addition to appropriate distancing in the workplace, masks are absolutely essential. And I think that where we're seeing the most success is where there is good leadership from the leaders in a company, from the leaders in a union, in terms of knowing what the goal is in the workplace, being able to express what that goal is, and then building discipline and, most of all, solidarity to succeed in keeping everybody safe. Now, I think that we need to get that mentality going as much as possible about, so people are focused on how do my actions have an impact on everybody else? And that comes into the mask wearing and physical distancing and lots of other things, not doing any risky behavior at all. How do my actions have an impact on everybody else? And that is the kind of solidarity that we're trying to build in workplaces and, of course, in the wider community. I had a very constructive exchange, written exchange with David the other day about communication and what we should be trying to communicate. And it is clear that mixed messages, vague messages are really unhelpful to people. It's not lockdown, it's not herd immunity, but what is it? And I don't think by expressing a vague middle path helps anything. I think we have to define what public health means to populations and then build commitment and support for that public health. And to try and get away from the 30 or 40 years of neoliberalism and individual consumerism, which focuses people on themselves rather than the wider collective responsibility in the community. So that was just, there was some more to our exchange, David, but I think it certainly started me thinking. I think that more thought into the communication is really important.
Thank you so much. Everybody, it is wonderful working with colleagues like Ian and James, because they are actively involved in different aspects of the response, and then are prepared to come on here and share their reflections. And I think there are many others. I see Jane Lawless is on. I'd quite like to call on you if you feel like it. And again, Holly and John, Sarah, I very much like your perspectives as well. People who are actively involved at the moment in trying to go for clear goals, discipline and organization, and then the solidarity and what it actually means to work in a way that is solidaire. And many of you know about that, because I actually think that right now, it is a really important moment for any of us who are in positions where we can influence others to be being extremely clear what we mean about a solidarity approach, what we mean about getting a system to work so that the different parts actually are relating to each other properly, what it means to be taking account of people's suffering and particular needs and weaving that into our work. Because some of those human-centered qualities are not always present in strategies, particularly when people get into the solemn, anxious, and almost we've got to protect ourselves because we're under attack type language, which can just lead to a sense of anger and frustration and make working together much harder. And I'm wanting to maintain a focus on promoting solidarity in responses. So James, thank you. And please don't hesitate, anybody, to come in if you feel that you've got anything to say. I want to welcome Shamim Talukdar to reflect on anything that you've got. Welcome, my brother William. Thank you for coming. So, Jane, I don't know whether you heard me, but if you do want to come in, just let me know. Meanwhile, I invite Annie Feltham to give her commentary. Annie, whose capacity for quite trenchant political analysis has helped us in so many of these discussions. Annie, you have the floor.
Thanks, David. I wasn't going to be particularly trenchant today. I was just, before I start, I was really struck by the thousands of seamen stranded, because I think one of the things that this virus has done, it's exposed things that were just hidden to most of us. Yeah. And I think that's really important. I just wanted to talk a bit about, and I think it falls really neatly into what we're talking about on solidarity, about the new social networks that we need, because our fractured lives, whether it's working from home or not having ready access to the things we assumed, whether it's at the school gates or the doctor's surgery or our clubs and social activities, that I'm really hearing from people locally about how they miss this, and how, so in practical terms, what does this new sort of solidarity mean? We're thinking about this locally because I think it just is so important, because we talk about it negatively from the fear and the isolation and the mental health. And I think we're getting so familiar with this now that I really like your positive language. Yeah. And I really like this idea that it's another side of get the vote out, really. It's actually that as individuals we matter. Yeah. And we can actually do things. And I think that's my less than normally trenchant message for today.
Well, I mean, it's lovely that out of some sense of anger and frustration, there is these shoots of really positive stuff that you're there. When you say that you're exploring these issues with others in your social network, be interesting. Is this your original social network that you had before COVID started, or is this new social networks that you've built since, or some mix of the two?
It's a mix of the two, because I still chair this NGO we have here, which is doing a brilliant job on the ground. And we're also, because we've gone into what is tier 2 in England, we're working with Essex County Council, and that's where the school comes from for Tuesday. In fact, it's from Colchester. And I have to, if I'm frank, it's a struggle to work with other political parties sometimes. and we're sort of learning how to do that. And I think one of the really interesting things, particularly in the UK situation, is how to not take the politics out of it, but how to take the partisanship out of it. Yeah. And so sometimes the NGO is a much easier way to work, because we're all facing the same direction. Yeah. And that team building and team support, it comes more naturally. I think that's what I would say there.
Well, thank you very much, Annie. James Ritchie, in his 3 words, said goal, discipline, solidarity. You've just said, in the NGO world that I'm working with, we're moving in the same direction. I do personally also agree that at this time, some clarity on the direction is so important.
Yeah, I agree.
Particularly when your numbers are picking up as fast as they are in different European countries. And so I'm wanting to delve in a bit more, and I'd like to invite Jane Lawless, who's written a comment in the chat that's relevant to this. Jane, tell us about yourself, and thank you for turning on your video. You have the floor.
Sure, thanks, David. My story is basically I've spent the first part of the pandemic in Switzerland and France, and recently went back to my home country, which is New Zealand. And it's been a really interesting experience to see the differences and the similarities between the countries. And, you know, New Zealand gets talked about a lot because of the success it's had so far in keeping the numbers down. But I guess my reflection has been a lot of that success has been not just that it's an island nation, but that it's had really simple, clear messaging from the beginning. It's had, for example, from the New Zealand perspective, the goal is clear to the citizenry. And in New Zealand, it's elimination. In other countries, it's different. Yeah. But everybody you talk to can tell you what that is. And then there was a key strategy simply articulated, which was from the Prime Minister, go hard, go early. And they had a really long, significant lockdown, which was helpful. And then a single unifying message to the population, which was, we're a team of 5 million. Now, the other reflection I've had since is that the strategy as it's executed doesn't have to be perfect, because the citizens forgive a lot if they feel that we're all trying with a common understanding of what it is that we're trying to achieve together. So wherever a country's at, if we can get that sense of we know what we're trying to do and we know that we're trying to do it together, and there's some sense of solidarity, the execution of the strategies follows from that. So I feel like it's kind of a message of, yes, other countries might not be in the elimination category, but it doesn't mean that we can't be effective. Thanks, David.
Very clear, Jane. Are you still working while you're in NZ, or have you stopped working?
Yes, I'm in New Zealand and I'm back working in the health sector, but COVID is not actually what's taking up our attention at the moment. But of course that can change. That can change very quickly, and we're very aware of that.
Well, thank you, and congratulations for the fact that society, the 5 million, acknowledged the leadership with a resounding support in the election. And it's lovely to see good leadership being recognised, actually, for me anyway. Very, very interesting. Can I just pick up something that Jane said? You don't have to be perfect. If people know what the goal is and they have got the language about how we're going to work on the goal, people will accept that sometimes stuff doesn't go exactly as you want it to go, but they want to feel part of the journey. Now, we've got people on who've joined for the first time. I've already acknowledged somebody who I'd not recognized before. I do sometimes miss people, and that was Selby Zuma. I'm seeing Patrick Wilson, who I think is a first timer. Patrick, what tends to happen is that we move around. So, and Selby's going to speak in a minute. Selby, I'll bring you in next. But I did want to acknowledge Patrick, and the way anybody joins in, there's a really interactive conversation, quite short inputs, because we try to weave a story while we're talking, and you can tell where we're at the moment. And I'm just saying that Anne Hendricks-Jenkins, you've just fabulous regular contributions, so definitely ask you to come in as well. So first of all, I go to Selby, then I will go to Patrick, then I will go to Anne. And if others need to come in urgently, just let me know. Selby, welcome. Tell us about yourself.
Thank you very much. I'm Selby Zuma. I'm in South Africa. I work for the NGO. So basically our role as NGO is try to bridge the gap between the communities and government. Yeah. The challenge with COVID-19 that we have faced in South Africa is that most of South Africa, the majority of the people are in the rural areas, which suffers with poor accessibility, poor infrastructure. So the COVID-19 has had an impact in those communities because lack of access in terms of testing. So we still struggle to get statistics, to collect statistics in those areas and in understanding exactly the impact of what is happening. Obviously, due to the lockdown in March, our government, I will say, took a much drastic close down, shutdown in the country. They used the army to basically block everything so people couldn't move to access the health facilities, which created a bit of a problem. But things are starting to open up now, where people then there is an improvement in terms of testing. Yeah. And access into needed facilities. Yeah.
Impressed, Selby, by the way in which society and authorities in South Africa have adapted and adjusted to some of the challenges. And really, you've managed to avoid a really horrible situation after some difficulties in Eastern Cape and in Western Cape, and a little bit in Gauteng. But just looking at the numbers, things seem to be much, much better. It's a case of really rapid learning by society. I don't know whether it feels like that to you.
Absolutely, absolutely.
Yeah. Well, thanks for joining us, and please stay in touch. We connect also between these briefings by WhatsApp and all sorts of other techniques, because we're learning together, and there's absolutely so much learning to do. Let's just go. I did think I just getting the order right. I can't remember whether I said Patrick and Anne or Anne and Patrick. Let's start with Anne first. Anne, please.
Hi, everybody. Good to see you today. And thank you so much, David. What really stood out from what you said and other people have said is the importance of the excitement and the solidarity. You know, finally, trust is getting to its place where it deserves. It's been dismissed before as kind of like a feel-good thing. So we do use the Collective Impact 3.0 approach, which is a very well-established approach of 5 elements that works super well in communities because it's very simple at its core, but it's evidence-based and a very rich approach. And one thing that stands out in there is that one of the 5 elements is authentic engagement. So I think from when people talk about communications, there's communications from the point of view of social and behavior change, which is when you have a predetermined behavior that you're going to try and convince people to adopt, like wearing masks or social distancing. So you have in effect decided that you know what's best because you're coming from a scientific standpoint, and that people need to be able to get that information and be able to act on it. So that's social and behavior change. But that's totally different than authentic engagement, which is where You don't know what's best. You're coming together in trusting, caretaking relationships based on mutuality, and you're going to co-create the way forward together. You know, within that relationship, then you may share some communications that are social and behavior change communications, which will be accepted because you have that trusting engagement. But too often, the two things are conflated, and people can feel the difference, and they need to be able to distinguish between the relationship and the messaging, both of which are critically important in a situation like this. So I'll stop there.
And you shared an article on LinkedIn about military style versus integrated local. I think you were, in that article, I think you were probing some of the contrasts that we were looking at in our initial framing. If I gave you another couple of minutes, do you want to just develop that thinking a bit?
Yeah, it's interesting because I've written some articles on opendemocracy.net, which have gotten many tens of thousands of reads, and I'm hearing a lot from people because the essence of the article about language was that we use a lot of language that's left over from the military and from colonialism with target populations and top-down things, after action reviews, things that were developed to be effective within the military sphere or in the neoliberal capitalistic sphere or in the colonial sphere. And none of those really feel very good on the receiving end, because even if the intent is not what was the intent of those original development of that terminology, the mindset is still baked in. And that's where we're coming up with the terms like solidarity and mutuality. Mutuality, for example, is about caring about other people and engaging in relationships with them where you care about their well-being without any idea that you're getting something back. It's not a win-win situation. It's not karma in the popular sense. It's about human caring that has no monetary value and is not a lesser than, greater than relationship that comes with supremacy thinking. So people, it's been a huge response to that, and I think people are really hungry to start to unpack this alternative way of coming together that is much more based on adults and coming together as equals who are equally concerned about each other rather than top-down, Western-driven, we know best kind of mindset, which none of us want to be like that, or people in this call probably don't want to be like that. But when we use that language or we use those framings, in effect, we're kind of being like that. And that interferes with our ability to develop true relationships that are really human to human and not about dominance or supremacy. So thanks for the opportunity.
So what, in a way, we were trying to do at the beginning of this briefing was to open up a framing which was about how we enter into relationships with others, potential, opportunity, excitement, valuing collective working, and seeing that as the goal rather than what it is we're trying to do. And that, I think, equates with Anne's point, where she says that what we've been doing is working on the relationships, this is her language, rather than on the behavior change that we're actually after. And I just want to hold that because I think there's something really, really important in that. Thank you, Anne, for the detail. Patrick Wilson, would you like to come in now? And then just say in terms of, I don't have my next speaker on a piece of paper, so be ready for a random calling. Patrick, please.
Hello, sorry, is my video on now?
Yeah, you're not.
Can you hear me? Oh, great. Okay, so thanks for inviting me. I'm Patrick. I currently work for NIHR, the UK National Institute for Health Research, and it's a new post, and I only joined a few months ago. So it's Head of Global Health Communications and Stakeholder Engagement. So it's working across the various centres and with the Department of Health and with various partners, particularly in low and middle income countries. Before that, I was at the Union against TB and lung disease, and before that, I was at LSHTM for many years. Oh, and in between that, I was at Help Age International NGO. And actually, what Anne just said and what other people have said on the call really resonates. And I think because this is such a sort of critical juncture, and I think what we're seeing is a kind of a breakdown of, to some extent, a breakdown of colonial command and control models and an emergence of new networks. And obviously, you know, as a middle class, white, Oxford educated, metropolitan elitist, you know, I'm undergoing my own decolonial journey. Luckily, yeah, I mean, I'm not a typical English bloke, even though I might sound like it, but who is? I'm sure David would say the same. But anyway, yeah, it's just great to be able to. I think what the other thing that has happened, even though obviously the emergency has hit everybody really hard in the way that people are able to do health service, you know, it's hit health systems, it's health services globally. I think what we're seeing also is a strengthening of networks locally and a mobilization around some key issues. I mean, as a funder, you know, where we announced that we made some awards for global actions against COVID on Friday, and some really interesting work that's already being done on the ground by our award holders and partners who are basically, you know, for the last few months been moving their activities into a sort of COVID response space, and working with, you know, with countries in the African Union, et cetera, to really understand the epidemic and to be able to, you know, support health systems there. Everything's moving so fast, but at the same time, it's also kind of a bit of a leveler in terms of, okay, there are still digital divides, and that's still a big issue. And actually, some of the funding that we're doing for capacity strengthening is basically buying mobile data for our partners and things in order to participate in these kind of meetings. But it means the fact that we've stopped bombing around the world to these conferences and, you know, burning up the planet quite as much accidentally. It's a
lot of thumbs up there. Yeah,
opportunities for leveling the playing field, and I think that's why, you know, that's why I was hired to NIHR to sort of push forward on that. You know, they call it leveling the playing field or moving the goalposts. As a football coach, you know, I'm not sure about moving the goalposts, but it's definitely, we're trying to shift the balance towards colleagues and partners in low and middle income countries and close to where the need is, as a sort of, and that's something we want to do for the world of global health research.
Very good. Well,
I'm sure David has a few views on that as well.
Chris Patrick, we can.
Thanks.
Really, really lovely to hear and to hear your energy, and the fact that you're working for a major funding body is also super good news. Here you got good thumbs up and lots of nice stuff in the chat, so that's a cool thing. Now we are talking about styles of leadership. We're talking about ways of creating patterns of leadership that, as Anne Hendricks Jenkins said, put authentic engagement right at the top. What is your approach to people, and how do you then build out of that to create really positive and exciting ways of dealing with this horrible threat? Holly Wheeler, I see I know you're in the car, and I'm sure it's antisocial, but in you come.
Morning, everybody. Thank you, David. Great conversations the last couple of weeks in terms of energy, and in terms of the stories that you were asking for at the beginning. The leadership that I'm noticing and experiencing is very different and is quite privileged this week, which I don't think I'd felt so positive before. So the story that I thought I'd share to begin with is just a discussion that I had with the leadership of a place up in the northeast of England. And we have started the conversation about what would living well with COVID look like, and what would it take from a leadership point of view and from a community point of view. And there's loads of great kind of people starting to go, oh, actually, I can recognise that as a way of thinking about what the leadership required is for that to live well, and what that looks like in terms of deeply listening to people's experience so that we can understand with them what that looks like to lead. And so a really tiny example is that what they're thinking about doing and have started talking to people about is bringing people from different parts of one community together kind of virtually to talk about their experiences of living with COVID and helping them as peers think it through. So it's kind of bringing that community connection. So it's not an authority figure in terms of a statutory person, it's someone local talking about their experience with a peer about what their experience is and what the future is, and trying to think about a longer term future, not just how do we get past Christmas, but how do we think about living well with COVID. And the other thing that I listened to on this call, which I think is really important, and I see at a local level starting to emerge now, is this idea that we have to learn how to do this. This is not something that we're magically going to know, and that humility in learning and the kind of authentic engagement a couple of people have been talking about, I think really matters when you're trying to learn, because you have to be in that sort of open space to go, okay, so this is my experience at the moment, it's not quite working, or I'm not sure about that. And so how do you engage with other people to help you? So it becomes a collective endeavour to learn how to do this. So although I've been feeling a bit pessimistic, I'm starting to feel a bit more positive recently. And it's really great to hear what you're doing and what others are doing as well.
Holly, great. And you see, it's lovely that Holly has been on several of these calls, and she can track the feelings that we have and then relate it to her own practice as a leadership trainer. I've noticed, I'm checking William Nabarro. William, I'm just wondering, I saw you turned on your video. Did you want to speak? Just tell me.
I'd just say one thing very quickly, David, which is, I think the discussion about command systems and command ways of language and styles in which to try to lead through this pandemic, it's a very relevant discussion, because as you've so often observed, the trouble is this is a new disease. Nobody understands all aspects of its dynamic or how to address it. Therefore, a command system is inevitably found to be brittle because it doesn't work. It's bound not to work. It can't work. And the disengagement that instantly or over time causes goes very deep, which is why a system of leadership, a style of leadership which is based on humility and consultation is bound to be more appropriate to this situation. And that's been evidenced over and over all around the world.
Thank you, William. And I've got, that's super important summary. Really very important. Learning approach based on humility and consultation is bound to be better than a command system which is going to be brittle and lead to disengagement. I hope that's an okay reflection of your words. Using that as a sort of summary of where we might be on this part of the conversation, I want to go to two very specific comments. Joe Nichols is going to talk about rather a specific experience about fishermen, but I want you, Joe, to think a little bit about what was the action, the leadership that led to these fishermen who were 12 months stranded due to COVID. What actually led to them being brought in? Was there some specific empathetic leadership that emerged in that situation? And Shamim wants to talk from Bangladesh, slightly different point. So first of all, Joe.
Thank you. So it's not terribly uncommon for boats to sometimes get stranded off the coast of Somalia because of the history of piracy. But this time, because of the COVID restrictions, it meant it was a lot harder for any solutions to be found. And actually, I mean, there was a lot of different levels of leadership, but there wasn't really any top-down leadership. So I think it chimes quite well with what William was just saying. It was a mixture of people from the authorities in Puntland, which is the sort of very Horn of Africa, right the way through to sort of project officers at the International Organization of Migration, and a range of people who essentially saw it as an achievable goal to find a solution, who just agreed to work together to find a hotel that would take them, very small things, but with a very clear end goal, which was to get them off the boat and to get them home. So I guess decentralized leadership and a lot of engagement with a shared goal.
And thank you, Joe, for coming back to that point that we had from Jane Lawless at the beginning, that the goal does matter. I used to sit in meetings with this guy called Jan Eliasson, and he used to get a bit mad. And he would say, stop squabbling over the roles of your different organizations. Put the problem in the middle of the piece of paper and work on the problem, work on the issue, work on the goal. Leave your organizational identities behind. It was always slightly embarrassing when he said that, because you thought, yes, yes, of course, sir, yes, of course, sir. But you can't help the fact that people are always a bit jealous and jockeying. So thank you for stressing the goal, which enabled all these different people, the national authorities, the International Organization of Migration, other people who wanted, presumably you might have been a bit involved as well, wanted to try to get this right, all coming together and doing that authentic engagement that Anne mentioned. Thank you, Joe. Joe, everybody, works on Somalia. She lives in Nairobi, but is always roaming around that region, and has been fabulous in keeping us informed. And it's her daughter, Zara, I want to give the commercial again, who's going to run the session that we're doing on schools and education, and that we mentioned at the beginning. Shamim Talukdar, Eminence in Bangladesh, thank you for joining us. Any quick thoughts? If you'd like to unmute, you could speak now. Thank you.
David, thank you. I just want to share my observation in Bangladesh related to the COVID management, and especially clinical management perspective. You know that, in Bangladesh, the first case was identified in March to this year. And at this moment, government has announced that second wave has already started in Bangladesh. And this month, we found that the case number is increasing as per the government data. So we think that, the number of cases will increase. But if you look at that, in terms of the logistics and healthcare services structure and facilities, you may know that, highest numbers of doctors have died in Bangladesh during these last few months. And the logistic for healthcare services, like, high flow machine, which purchase system started like 5-6 months ago. UNICEF is providing supported for the government. ADB, World Bank also helping government by providing the resource, but we still have not yet able to purchase this high flow machine in our hospitals, in the central hospital, as well as, if you look at that all over the country, there is nothing in a logistics system is available at this moment. Other perspective, we have, Eminence also started a project with NCD Alliance, Global NCD Alliance, to do the advocacy related to the non-communicable disease and COVID-19. And we found that diabetics, hypertension, cancer-related service is also very, bad situation in terms of logistics services for the doctors and the patient. So my feelings is that maybe we can think about, in a different structure, top-down approach like Gavi. Gavi actually give a tremendous scope of access to the vaccine for the people in developing countries like Bangladesh and all over the world. So maybe we can think about a organization like Global Alliance for Logistic Initiative. UN can think and you can promote this thing to ensure the logistic for the developing countries for healthcare services related to the non-communicable disease and COVID-related services. Thank you for giving me this opportunity.
Thank you. What a really important statement. the reality is, talking with yourself, talking with Rojan in Nepal, talking with colleagues in other parts of the South Asia region, it's really difficult. There is just a total lack of the essential logistics that are needed to protect workers and manage the patients. And we really must not forget this. The system of ensuring supplies to poor countries for the benefit of people in their countries is broken. Thank you for reminding us, and I will remember your Global Alliance for Logistics Initiative, or GALI. We keep talking about it, Shamim. Thank you for that suggestion. We're reaching the end of our hour, and it feels like time has just rocketed by. I do want to say to Molly Melching, we're not quite sure where you're from, Molly, but thank you for joining us. We think we were looking up Molly Melching on Google. Just wanted to say, where are you from, Molly? Just greet us and then we will close.
Hi, I'm in Senegal, West Africa, and founded the NGO Tostan. And we work in 5 West African countries, but we were also in Somalia and Djibouti. And totally agree with what everybody has been saying. And I think it's great because these are messages, or this is information and knowledge sharing that is hard for people to understand. And it's something that Tostan has been trying to do. But we totally agree. It's so important to listen first to communities. We go into communities for 3 years with a non-formal basic education program, but it's totally based on their vision for what well-being means to them and their values. The values part is extremely important. And it has led the thousands of villages where we have worked to really making incredibly important decisions about ending harmful social norms that exist in their community. But it has been based on their values, their vision for what they want for the future, and of course, with really good information that we provide in national languages. Of course, we work in 22 national languages, and again, 3 years, and afterwards have post modules on, we've done a lot of work on COVID-19, but again, listening to people and what the problems in the communities are. We found almost no materials on COVID that were related to the realities and priorities of villagers. So we worked on that, and we have open source on our website materials in national languages, an Islamic perspective on the COVID and epidemics and pandemic, and also another on villagers' realities related to the suggestions they made for preventing COVID in their communities.
Wonderful. Molly, you're welcome. Please stay with us. Join us for other sessions if you like, and connect through the LinkedIn. Anne Hendricks has written saying, your work is truly groundbreaking. I think it's wonderful that you've chosen to join us and introduce us to Tostan. We will, all of us will read with great interest and learn from you.
Yeah, I think we should, I really just want to add this, Anne's talk about vocabulary is so, so important. Yeah. I so totally agree with her, but you get a lot of pushback from this from people. You know, you get accused if you don't go in, you know, using feminist language, and you know, it's just when you work in communities where there are a lot of misperceptions around language, it's so important to be non-judgmental, to be very careful about the vocabulary you use, and just and really just listen to people and the way they frame things. Go in with the frame, a non-judgmental frame, an open listening frame. It's, you know, we've been working for 30 years here.
Wow.
And based, well, yeah, I've lived here 45 years, and it's really based a lot on our cultural studies and lots of research and working with the way people speak in national language and what is important to them first.
Merci. Thank you very, very much indeed. John, a moment for you to reflect, and then I am going to go to Twee, Pete Maury, and then finish. John.
Okay, so just listening to the threads of all of this, David, we came in on sort of your question, which says, you know, so does the messaging now need to be solemn or honest or sort of positive? And the conversation's gone quite a long way from there in a lot of ways. And I think what I'm hearing through all this, or what I'm taking from it at least, is, you know, somebody said you don't have to be perfect, but I think you do have to be human. And what we tend to do is sort of create cults and you know, unrealistic hopes, and people feel they have to fulfill them in their messaging. And what's probably much more important is, and building on Molly's comments at the end there, is you have to listen. If you want to work out what your message is, you've got to listen and feel the mood and feel what's needed now, and see the messaging as a part of the feedback process that connects people better together in such a way that we actually start to build a learning relationship with people, and something evolves out of that that really, really works. And if we keep thinking that our messaging has to be a process of just sending and directing and informing, those are things you can do in messaging. But ultimately, the challenge that we found, David, as we've gone through this over and over again, is people need to decide for themselves to do things that are going to break chains of transmission. And they will only do that when they believe that the things that they're doing are good and right and helpful things for them to do. And that's not going to happen by us constantly telling them. It's going to happen by us listening to them and working out with them what might be the best here, right now, in the place that they're in.
Thank you, John. There's somebody who's got a Zoom code on their identity, a lady, and I can't work out who you are. And I've been asking, but I will perhaps try and connect with you later. I did say I was going to Twee next, and then Twee will introduce Pete and enable Pete to show his picture. Twee, please.
Thank you. So just sharing the results from today. We have most people joining from Europe, but always good to see a few people joining from East Asia and Pacific region, which is why we hold these sessions on Fridays at this time. The jury is still out on whether we split Europe and North America to better recognize those who join from the UK and Canada. If you want to jump in on that poll, it's on our LinkedIn community chat. In terms of age range, nice spread across all age groups. And yes, hopefully next Tuesday, we'll see a massive change in the under 30 years group for our students session. And then for number 3 on how we're all feeling today, interestingly, still hope for, optimism and hopefulness lead, but nice to see the different spread across the 3 other more positive emotions. And then just a few people feeling more in the negative emotions, but no one super low today. So that's good to know. But yes, please do connect with me on LinkedIn and join our community chat there. Thank you.
Thank you, wonderful Twee. And we did have quite a strong representation from New Zealand on today's call. Joyful to have you Kiwis here with us. Pete Morey, please. Pete, tell us what it's been like drawing today. Lovely, lovely pictures. Gosh.
Oh, thank you very much. Hi. Well, I've drawn, I've attempted to draw Jacinda Ardern in the top right, or the sort of middle right corner, as a sort of positive example of perhaps suggesting this learning together and relationships over a top-down approach. There's this sort of central to right yellow square with that kind of description. And I suppose I've been building it sort of intuitively and fluidly around that. And then these 3 banners with define public health clearly and build from there, promote solidarity with the notion of being human is better than being perfect, and building logistics in the bottom banner here. And then lots of messaging around that.
Thank you very much indeed. Wonderful, Pete.
Thank you.
Skill doing this, and everybody, the picture and the recording will go up as soon as we can do it. Next Tuesday is our special session on schooling, led by people much younger than me. I'd just like to greet all friends and family who are on the call, particularly my daughter Polly, who's here. And thank you. There's my grandson, Isaac, who is happy to be with us today. And my grandson, Otto, who I've not yet met. Wonderful. Nice to see you all. all. And with that, it's bye-bye. Thank you to the team who've been really great in preparing for this. We spent a lot of time. To Zara Nichols, looking forward to seeing you on Tuesday. Sarah, nice to see you wearing your mask. Thank you for turning on your video. And everybody else. Loy, thank you for being with us. Louisa, wonderful to see you. Marianne, brilliant. And everybody who's on this call. Claudia, sorry I didn't mention you. And Haruko in Tokyo, I suspect it's not a very good time for you. Thank you for joining and for keeping us in touch. Very, very important discussion today. With that, bye-bye from all of us. Bye. Bye.